could get 4 weeks of vacuum, then Granulux, it's completely closed and completely healing after years of non-healing. The message about this is that we are advancing in the field of vacuum therapy, advancing in the field of impregnation of the wound by oxygen in form of Granulux. Adding these two together, we mentioned what we are here for today. That's the advancement in tools, advancement in techniques, as well as also in lymphedema. We can apply vacuum, we can get better wound healing. This slide is meant to be left white and clear for the next year, where we will find more applications and more tools and much more mobile applications that could clearly judge the wound, clearly help in wound healing, and clearly the artificial intelligence is coming in real life. Thank you very much.
Thank you, Dr. Ihab. I'm sure this will excite lots of questions.
May I have the honor to present further beyond what I have said? That's new options for no option patients. I would love to present, always honored, Professor Giacomo Glerici, a known diabetic foot surgeon, member of the board of the International Association of Diabetic Foot Surgeons, Polyclinic of Albano Term, and Hospital San Carlo, Milan.
Yep. Yeah. Okay. Perfect. Okay. Thank you. Okay. Ladies and gentlemen, dear colleagues, first of all, chairpersons, of course. First of all, let me thank the president, the members of the scientific committee for this kind of invitation, and in particular, a good friend of mine, Rashad Bishara, for these beautiful days in Hurghada. So I do not have any conflict of interest to declare about this lecture, and I would like to share with you a clinical case we faced a few months ago about a 75-year-old type 2 diabetes patient with neuropathy, with pacemaker, hypertension, chronic kidney disease, stage 3, who underwent previous revascularization of coronary artery with Marco Manzi, Mariano Palena. I am very lucky because I am a foot surgeon and I work with the very three monsters in the interventional world field, Marco Manzi, Mariano Palena, and Roberto Ferraresi. But they found a very bad situation because this patient had a small artery disease with severe calcification, and they tried in April, but in May this patient still has a rest pain, but unfortunately with gangrene of the first and second toe. So rest pain with foot gangrene, prop to bone positive in the forefoot, and with these angiographic findings, you can see that we have a very, we call it desert foot without, if you look at in the right bottom, you can see even the perfusion is completely down. And the TCPO2 was 16 millimeters of mercury. So we thought about another option. We published about the vein arterialization, but unfortunately, this patient has some problem with the vein because he had a previous coronary artery bypass graft. And so a few weeks before visiting this patient, I met these two guys somewhere around the world in a conference. They talked to me about a new device, the transverse tibial bone transport with the TTT system. And I don't know if you are familiar with Elizarov technique with external fixation, with hardware or something like that. But this device is the rational in this device, tibial cortex transverse transport surgery, is based on the Elizarov law of tension stress, which states that slow and gradual destruction of the bone activates and enhances the regenerative potential of living tissue. This is the surgical procedure, but we are going to see better in the next few slides. And summarizing, we can say that according to the Elizarov data, he started in the 60s, and after that in the 80s, he started to publish a lot about this procedure. We have a local response and of course a systemic response. And if you look at this paper, has been published in 2020, you can see that we have an increased blood perfusion and also an increased blood flow in patients who underwent this kind of surgery. So behind the science behind is that we have an increase of many molecules, many important actors in the wound healing process. You can see that the local responses we have the bone morphogenetic protein increase. BMP is a TGF beta superfamily factor. We have an increase of activin type 2. We have an increase of also of the hypoxia inducible factor 1 and vascular endothelial growth factor. So you can see that just in 8 minutes, it's quite impossible to sum up all the information. And we also a systemic response with the mobilization of MSC, the endothelial preservator cells, also circulating cytokines level changes, and remote bone remodeling. So this is the device. You can see here, this is what you have in your operating theater if you carry out the surgery. From a surgical